Hi viewers, welcome to my channel. இன்னைக்கு டாபிக் ஜெனரல் பெத்தாலஜியில் செல் இன்ஜுரி, செல்லுலார் அடாப்டேஷன் அண்ட் செல் ஏஜிங் இந்த சாப்டரில் இருக்க MCQs பார்க்க போகிறோம். ஃபர்ஸ்ட் கொஷின், hyperplasia generally means option A, an organ will increase in size due to excessive formation of extracellular fluids. Option B, increased cell production in a normal tissue. Option C, shrinkage in cell size. Option D, bleeding at the periphery. The correct option is option B, increased cell production in a normal tissue. Next question, necrosis is option A, reversible. Option B, lack of oxygen to the tissue. Option C, not reversible. Option D, bleeding at the periphery. Option C, not reversible is the correct option. Monocytes are option A, phagocytic cells. Option B, red blood cells. Option C, carriers of oxygen. Option D, produced in the kidneys. Option A, phagocytic cells is the correct option. Next question, true about apoptosis or all except option A, inflammation is present. Option B, chromosomal breakage. Option C, clumping of chromatin. Option D, cell shrinkage. Option A, inflammation is present is the correct option. Most pathognomic sign of irreversible cell injury. Option A, amorphous densities in mitochondria. Option B, swelling of the cell membrane. Option C, ribosome detached from endoplasmic reticulum. Option D, clumping of nuclear chromatin. Option A, amorphous densities in mitochondria is the correct option. Programmed cell death is known as option A, cytolysis. Option B, apoptosis. Option C, necrosis. Option D, proptosis. Option B, apoptosis is the correct option. Irreversible cell injury in cells is option A, deposition of calcium ions in mitochondria. Option B, swelling. Option C, mitotic figure. Option D, ribosomal detachment. Option A, deposition of calcium ions in mitochondria is the correct option. Apoptosis is option A, cell degradation. Option B, type of cell injury. Option C, cell regeneration. Option D, cell activation. Option B, type of cell injury is the correct option. Apoptosis is alternatively called as option A, ischemic cell death. Option B, programmed cell death. Option D, C, post-traumatic cell death. Option D, all of the above. Option B, programmed cell death is the correct option. Liquefactive necrosis is seen in option A, heart. Option B, brain. Option C, lung. Option D, spleen. Option B, brain is the correct option. Coagulative necrosis is found in which infection? Option A, tuberculosis. Option B, sarcoidosis. Option C, gangrene. Option D, fungal infection. Option A, tuberculosis is the correct option. Caspases are seen in which of the following? Option A, cell division. Option B, apoptosis. Option C, necrosis. Option D, inflammation. Option B, apoptosis is the correct option. In reversible cell injury, all are true except option A, ATP depletion is responsible for acute cellular swelling. Option B, can cause myocardial cells to cease contraction within 60 seconds. Option C, ATP is generated anaerobically from creatinine phosphate. Option D, mitochondrial swelling and degranulation of endoplasmic reticulum are hallmarks of irreversible cellular injury. Option E, associated with myelin figures. Option D, mitochondrial swelling and degranulation of endoplasmic reticulum are hallmarks of irreversible cellular injury. What would be an example of hypertrophy? Option A, breast development at puberty. Option B, enlargement of the uterus during pregnancy. Option C, enlargement of the uterus during menstruation. Option D, a papillomavirus induced skin wart. Option E, liver regeneration after partial hepatectomy. Option B, enlargement of the uterus during pregnancy is the correct option of hypertrophy, correct example of hypertrophy. Which tissue is the most susceptible to liquefactive necrosis following ischemic injury? Option A, pancreas. Option B, liver. Option C, spleen. Option D, brain. Option E, intestine. Option D, brain is the correct option. Apoptosis has the following features except option A is there is cell shrinkage in apoptosis. Option B there are no acute inflammatory cells surrounding apoptosis. Option C there may be single cell loss or affect a cluster of cells. Option D apoptosis is seen in pathological process only. So the correct option is option D. Apoptosis is seen in pathological process only is not the feature of apoptosis. So option D is the correct option. Apoptosis is seen in pathological process only. Diabetic foot is an example of option A digangrene, option B wet gangrene, option C gas gangrene, option D necrotizing inflammation. Option B wet gangrene is the correct option. Caseous necrosis is characterized morphologically by preservation of tissue outlines, basophilia, semi-liquid consistency, wedge-shaped periphery, amorphous appearance. Gaseous necrosis is characterized morphologically by amorphous appearance. So the correct option is amorphous appearance. A patient suffers a stroke and has left-sided weakness and paralysis in the upper extremity. The type of necrosis associated with a well-developed infarct of the brain is option A coagulative, option B enzymatic fat, option C liquefactive, option D gangrenous. Option C liquefactive is the correct option. In hypoxic cell injury, cell swelling occurs because of increased intracellular lipid, protein, lipofuscin, water, glycogen. In hypoxic cell injury, cell swelling occurs because of increased intracellular water. So, option D, water is the correct option. Cell death caused by autolysis is produced by option A, antibodies, option B, endogenous enzyme, option C, phagocytic leukocytes, option D, bacterial enzymes. Option B, endogenous enzymes is the correct option. A pathologist notes cloudy swelling, hydropic change, and fatty change in a patient's liver with a history of alcohol abuse. These morphological changes are all examples of early neoplastic change, hyaline change patterns of cell death, postmortem artifact, reversible cell injury. Option D, reversible cell injury is the correct option. Which of the following is an example of hypertrophy? Option A, increase in liver size after a partial hepatectomy. Increase in the size of a female breast. Option C, increase in respiratory epithelium in response to vitamin A deficiency. Option D, increase in size of the female uterus in pregnancy. Option D, increase in the size of female uterus in pregnancy is the correct option. Regarding fatty change, which is false. May option A may result from protein malnutrition. Option B fatty acids are oxidized in the mitochondria. Option C may result from diabetes mellitus. Option D may represent unmasking of normal cell fat content. Option D may represent unmasking of normal fat cell content is the correct option. Irreversible cell injury is characterized by option A loss of functional polarity in polarized epithelium, option B detachment of ribosomes from endoplasmic reticulum, option C acute cellular swelling, option D severe mitochondrial vacuolization, option E formation of membrane blips. Option D severe mitochondrial vacuolization is the correct option. All of the following are morphological features of apoptosis except option A cell swelling, option B chromatin condensation, option C lack of inflammation, option D phagocytosis of apoptotic bodies, option E formation of cytoplasmic blips, option A cell swelling is the correct option. Features of reversible cell injury include all except option A swelling of the cell, option B clumping of nuclear chromatin, option C autophagy by lysosomes, option D nuclear chorioresis, option E ribosomal dispersal, option D nuclear chorioresis is the correct option. Metaplasia is reversible change from one cell type to another. Option A. Option B. Irreversible change from one cell type to another. Option C. Reduced function of cell. Option D. Increased in the number of cells. Option E. Increase in the size and function of cells. Option A. Reversible change from one cell type to another is the correct option. In necrosis, option A. The nuclear changes are due to non-specific breakdown of DNA. Option B. Coriolysis and pyknosis are the only two types of nuclear changes. In caseous, option C. In caseous necrosis, the basic outline of the cells is preserved. Option D. There is a decreased eosinophilia in the necrotic cell. Option E. Liquefaction necrosis is characteristic of hypoxic injury. Option A, the nuclear changes are due to non-specific breakdown of DNA is the correct option. Dysplasia is a feature of option A mesenchymal cells, option B inevitably progresses to cancer, option C is characterized by cellular pleomorphism, option D is not associated with tissue architectural abnormalities, option A is the same as carcinoma in situ. Option C is characterized by cellular pleomorphism is the correct option. Regarding atrophy, which is false. Option A, persistence of residual bodies, decrease in myofilaments. Option C, decreased of endoplasmic reticulum. Option D, decreased autophagic vacuoles. Option E, decreased smooth endoplasmic reticulum. Option D, decreased autophagic vacuoles is the correct option. Thank you for watching.